Welcome to the series of lectures for rural surgeons organized by the International Federation of Rural Surgeons. This is a summary of the lecture we had about restarting surgeries after the COVID pandemic in one of the hospitals in Jharkhand called Shanti Bhavan Medical Center in Simdega district. The Simdega district is the most backward district in Jharkhand. And this hospital serves a huge population. If we have a look at the scenario of infection among the healthcare workers, it's about 10% all over the world. It's more in Western countries, reaching almost 15 to 20%. And in India, its average is about 10%. And in designated COVID care centers, the average is actually much higher. It's almost 20%. So what did this hospital achieve? It was treating about 1/3 of the patients who had COVID positive in Simdega district, over 200 patients. And none of the hospital staff were infected. Also, there was no infection among the relatives or visitors who had come to the hospital. So what are the things we can learn from them? So well before the pandemic started, they started preparing for it. They had no access to PPE, so they started making their own locally made ones. Then they had training for all the staff at all levels. And they spent a lot of time in preparing the various protocols. One of the problems was that once it was designated as a COVID care center, there's a big stigma in the villages. The staff were not allowed to go back to their houses in the villages. So many of them were forced to stay back at the hospital. So they opened one ward and where all the staff stayed. And the hospital had to take care of feeding them and taking care of them. So the entire group of staff stayed at the hospital. And then for PPE, whatever was available at the hospital, they started making the various barriers and how to examine and how to save themselves from the virus. And once they started preparing the protocol, they started training the various categories of staff. They felt that class 4 staff were especially important because they can easily forget what they learned. So there were several sessions which were organized for teaching and training them how to take care of the waste, how to collect it, dispose it, and so on. Several mock drills were conducted about how to take care of the patients when they come in, how to check the vital signs. And since they had no access to the visors or the face shields, they started using the ordinary plastic or polythene bags for it. And they checked the oxygen saturation and found that it was adequate, even if they wore it for 1 or 2 hours and so on. And then they started using it. And they did not have this fancy infrared thermometer. So what they did was they developed a long spoon so that the patients can take it, measure it, and tell what temperature it is, and then they can put it in their disinfectant. And the patients, initially they had a mask and instead of a visor, they started with a polythene bag, which obviously would be uncomfortable. So later on, they started developing this one with the 20-liter water bottle. And when necessary, the oxygen was able to be delivered to the bottle. They also prepared for treating the patients in prone position and again intubating if necessary and so on. And about the medicines, all the staff had hydroxychloroquine prophylaxis. And the patients were treated with the chloroquine, azithromycin, ivermectin, doxycycline, and the other medicine which are used for treating common cold. Total about by September, 176 patients were treated. And all of them became well. None of them needed anything more than oxygen. None of them needed any ventilation. And all of them recovered and went back without infecting any of the staff or their relatives or people who came with them. Now, the last 2 months, they stopped treating COVID patients. They're no more the designated COVID care center. But still, they follow the protocols which are already there. Like as soon as they come, they stand in the marked places, temperature checked, symptoms screened, and also fair amount of education of the patient takes place. Then at the registration, all the patients who come there, they receive a face mask and a shield, and they make sure that they are wearing them whenever they are at the hospital. If any of them are febrile, there is a separate outpatient OPD where they need to go. And still the barrier technique is used for checking the oxygen saturation, the vital signs, and so on. And consultations, again, there are two things that happen. One is that initially they started with maintaining the various distances, 6 feet distance, wearing the visor, mask, and the local doctors were used to this quite comfortably. But whenever there were any specialists who were visiting, then the protocol changed a little bit. Initially, the specialist talked to the patient through Zoom consultations and order the investigations. They spent only a short time examining the patient. Then again, the prescriptions and all the writing work, everything was done through Zoom meeting. This way, they spent as little time in direct contact with the patients as possible. So this reduced the time they spent with the patients and the possibility of transmitting infections or getting infected. And the staff always wore PPE. They had double mask, visor, then 2 sets of polythene sheets. And all these scrubs cleaned with hypochlorite and washed at the hospital so that they didn't take home any of the contamination or virus with them. And right now, all the inpatients have been tested for COVID, and only when they're negative, they're admitted. And patients who are there at the emergency or the waiting area till the results come in, they're treated as positive patients with the full PPE. And for elective surgeries, they prefer spinal anesthesia. And as shown here, they developed a special shield to cover the face. And if oxygen is necessary, they use the 20-liter water bottle with the attachment for oxygen, which they use. Here, the patient had only spinal and there is no need for extra oxygen. And surgery, the special suctions are developed to use all the time so that there is no aerosol which spreads through the theater. And then in addition to the regular drapes, sterile, polythene drapes were used. These are just ordinary polythene sheets. And the staff were, of course, full PPE. And even though the air conditioner was on, all the doors were open so that the air is not recirculated. The International Federation of Rural Surgeons, they recommend that during COVID or after the pandemic, it's safe to use gasless surgeries because the incisions are small. What makes regular laparoscopic surgery not very safe is that the viral content of the peritoneal fluids is about 10 times that in respiratory system also. So hence, with positive pressure, the regular laparoscopic surgeries can quite easily spread the virus all over the theater. Gasless system, because it's an isobaric system, there is no such spread. And also through a needle or through one of the ports, we can continuously use suction so that there is no escape of smoke or any of the contaminants. And this makes gasless surgery safer than even open surgeries. And fortunately, the viral content in urology surgeries in urine is much less. In post-operative period, the entire linen, everything which is used is soaked for about half an hour in hypochlorite solution. And the OR floor and surface is again cleaned with hypochlorite solution. And in addition to the usual precautions, they allow as little contact with the relatives and others as possible for all the patients. So what did this involve the hospital? So all these new protocols, new PPE, everything increased the cost of treatment by about 25%. But unfortunately, initially the hospital patients were all poor. So they treated thanks to the various government programs, which were reimbursing the hospital for treatment. But unfortunately, after the pandemic, the government reduced the amount they were reimbursing to the hospitals, although the expenses went up by 25%. And what do we learn from all this? How do you make sure that there's hardly any infection and motivate the staff? What Dr. George Matthew feels is that you need to adapt, innovate, and improvise. And the leader has to lead from the front. There's no other choice. And someone has to lead. Without any leader, nothing will happen. And you need to be a servant leader, which the Bible recommends. Thank you.